Good afternoon and welcome to our daily media updates. Today we're going to be hearing from Supervisor Fletcher with an update on our informational charts and graphs, and then we'll get a medical update from Dr. Wooten. But before we get to them, I want to talk about our county's actions to fight the virus. Earlier today, the Board of Supervisors held a virtual meeting and we heard a comprehensive update on the status of our COVID-19 response. If you missed it, you can find the video of the meeting on our county website at sandiegocounty.gov. It was a long meeting, so let me just summarize very quickly. Our county team continues to work around the clock, 7 days a week, 24 hours a day, to slow the spread of the virus. In addition, we are reaching out to our communities and community partners to keep everyone informed and engaged in our efforts. We continue with regularly scheduled conference calls, encouraging a two-way communication and virtual town hall meetings. We started with 8 sectors of the community that we held weekly conference calls with, and we are now up to 16 targeted sectors. So far, we have held over 170 sector outreach activities or conference calls. In addition, we continue to hold our daily media briefings, and we have engaged our San Diego County community with the Live Well at Home outreach effort. Since its inception, the Live Well at Home website has seen over 28,000 unique website visits, and our hashtag LiveWellSD and hashtag StayHomeSD campaigns continue to engage more and more residents each and every day. Our efforts are making a difference, but we're not out of danger yet. And as you'll hear in the medical update this afternoon, it's because of your efforts, though, that we are now in active discussions on plans to reopen San Diego. But we'll only do so when we get the correct information that will allow us to do so, and it's going to be gradual and in conjunction with criteria from the federal and state governments and with evidence we see and hear locally on the ground. To help speed up with a return to active life, we have created a laboratory testing task force that will, among other things, identify gaps and opportunities for increasing the region's full testing capability. Looking ahead, we have joined with the City of San Diego to create a recovery advisory group comprised of business leaders who will recommend guidelines and protocols for businesses to reopen safely. Now, let me emphasize, it's not going to happen all at once. We will reopen in phases, and we will hopefully soon ease our public health order, allowing people to use parks, trails, and golf courses, but with restrictions. To paraphrase the Surgeon General, reopening will not be a light switch, but more like a sunrise. But how soon that happens is really up to each and every one of us. We need people to continue to follow the governor's executive order to stay at home and recommendations to cover your face. Please practice social distancing, maintain 6 feet between persons, and continue good hand washing practices. San Diego, if we continue to do that, we can keep up our momentum to knock out COVID-19 altogether. With that, let me please welcome Supervisor Fletcher.
Thank you, and good afternoon. Today we are reporting, unfortunately, the single highest number of deaths since the start of the COVID crisis, 15 new deaths reported today. We're also reporting 109 new positive cases, which is our highest daily total reported in more than 2 weeks. We have repeatedly stressed that we don't make decisions based on one day of data. We want to look at larger trends. But today's numbers are a sobering reminder that we must remain vigilant, that we are not out of this yet. While we see calls to immediately open things, while we see large gatherings out together in public, we have to continually be reminded that the progress and actions that we've taken thus far, the sacrifices that have been made, have been designed to flatten and lower the curve, to lower the rate of transmission, to lower the number of cases, to lower the number of deaths, to lower the number of hospitalizations. And that is what is going to give us the foundation that we can build upon to come out. And while many people continue to implore immediate action, I want to remind that yesterday Dr. Anthony Fauci provided a very direct message to those entities and jurisdictions that are moving too quickly. To quote him directly, he said, "It's going to backfire." That is the problem. Yesterday, we laid out some guidance on what it will take for us to begin to consider reopening parks, trails, and beaches, along with some specific guidance to businesses about preparing for the next phase. And that is the work that needs to start so we are ready when it is time. But to be clear, the decision on when to open up will be determined by data. The guidelines will be developed by public health experts in consultation with state and federal leaders. It will be a public health, public safety-based decision, not a political decision and not an emotional decision. It will be one based on the data about what best serves our region and provides the smoothest and most consistent recovery. To do otherwise would be irresponsible. We can look to history for a few examples that can help guide us in terms of shaping experiences from this. The most common scenario that we are facing when you look historically is the 1918 flu pandemic. And I want to bring up a chart. It's a little bit crowded, and I'll break out a few of these. But what you can see in this instance is a number of jurisdictions that acted too late on the front end, and they saw significant spikes. The numbers in gray here represent deaths per 100,000 residents. And so you see a number of jurisdictions that acted too late and saw a significant spike. You saw a number of other jurisdictions that came out too early and saw second waves, and then sometimes second waves that were much more significant than the first. Second waves that required, as you see there in the tan box, the reimposition of social distancing, physical distancing measures, many of the same things that we are doing today. If we go to the next chart, you'll see in a few of specific examples. Philadelphia being an example of what we did not do here, but what you did see play out in multiple places around the world. Philadelphia waited 8 days after their death rate began to climb significantly to take steps and actions, and by that point it was too late to stop the overwhelming of their healthcare system and the significant spike in deaths. If you look at New York, that is more a testament in 1918 at least of what should be done. They started early, they endured their wave, they held the appropriate amount of time, and they came out smoothly. When you look at the example of St. Louis, it's an example of what you don't want to do, where they had a relatively gradual climb, they flattened a little bit, they came out too early, they saw exponential growth, and both San Francisco and St. Louis are representations of prolonged periods of death beyond the initial wave, and it is vitally important to us here in San Diego County that we learn from these lessons and we apply these lessons in order to ensure not only the best protection for the health and safety and life of our residents, but also the best protections for the economic development. In order to have a smooth economic recovery, we have to align the interest of public health with the interest of rebuilding and reopening. I want to bring back an updated chart that gives us a more present-day example, that of Singapore. Singapore had widely been touted in response to this COVID response in 2020 as the gold standard. They took early aggressive action. They did not see a huge spike. And then as they are ahead of us, they did see significant increases after having initial positive success. The orange graphs here represent the actions that we took and our positive cases that you can see right there. The dotted blue line represents what would happen if we would follow Singapore's trajectory. And again, Singapore was widely touted as having done everything right on the front end, but they lost their focus, they lost their commitment, and they saw significant increases after all the sacrifices has been made. We don't want to replicate the mistakes of 1918, and we don't want to replicate the mistakes of other countries and jurisdictions in 2020, which is why we continue to ask you to please help us, join with us in the month of April, being a month of action, being a month of commitment, being a month of sustained progress that can lay the foundation for what we would like to see and will give us the best opportunity to open up moving forward. Let's jump into our daily charts. Again, today you'll see here we're representing a total of 109 positive cases, which is our single largest day jump going back to April 4th to bring us to a total of 2,434 positive cases. No significant change in the number of testing that was reported. Yesterday we were reporting 1,016 tests which is right in line with about what we've been doing most days recently, bringing us to a total of just under 35,000 tests total for San Diego County. Here you can see the breakdown in positives versus tests. And again, we will begin providing this in a day-to-day breakdown of the daily percentage of positives versus tests. You can do the math with the last charts, but we'll work on graphically demonstrating that to you. The next chart represents our total positives, which we just reported, 2,434. That puts us presently at a doubling rate of every 24 days, down a little bit from yesterday. Our estimated recoveries, which you see right there, the increase in hospitalizations along with the hospitalization doubling rate, increase in ICUs, and the additional loss of life, 15 additional losses of life, but the 15 in parentheses there represents the doubling rate of deaths and not the total increase for today. Our other metrics, motel rooms, very little change in those today, slightly down in the public health, flat, up a little bit in the RTFH rooms. On our outreach efforts, increases in pretty much every category, 211, nursing, epi, jump and hygiene kits, an increase in 10 additional hand washing stations that have been deployed, and portable toilets remain flat. Personal protective equipment, again, we had another day with an increase in every single category. This represents individual items of personal protective equipment that we at the county are distributing to our healthcare partners. Every category going up in the last 24 hours, now putting us at more than 2,250,000 individual items of personal protective equipment that have been distributed. On ventilators, we're looking at 22 of 23 hospitals reporting their availability, presently standing at 540. Along with over 100 that are in the county possession and are ready to deploy if they were needed. That concludes my report. I'll turn it over to Dr. Wilma Wooten for our public health officer briefing.
Thank you, Supervisor Fletcher, and good afternoon, everyone, and thank you for attending this briefing today. Today at our Board of Supervisors meeting, the federal guidelines, Opening Up America Again, and the governor's California roadmap to modify the stay-at-home orders were reviewed. The governor's roadmap includes 6 indicators, and we are updating activities that locally San Diego is conducting in 5 of these 6, with the exclusion of number 4. And we are working to enhance and explore opportunities to improve work in those 5 indicators, and we will continue to update you with that information. Today, I want to emphasize that any metrics must meet federal and state guidelines for reopening. And as such, I'd like to take just a few minutes to review the federal government's 5 key metrics. The first is a downward trajectory of influenza-like illnesses, or ILI, over a 14-day period. If you can go to the next slide. The second is, and regarding the influenza-like illnesses, we have met that particular metric. Since March 14th, we have gone from 10% down to 3% of individuals presenting to the emergency departments for ILIs represented by the reports from our emergency departments. So for all visits to emergency departments, now we are currently at 3%, which is the yellow line, compared to 10% almost 5 weeks ago. So for that metric, we have met. The second is a downward trajectory of COVID-like syndrome cases reported in a 14-day period. And as you can see, that's represented by the blue line. And we do not have a downward trend. If anything, it is leveled, but it is most likely increasing. And with the cases that were reported today, you will see that increase. Even today is only 1 point. We have to look at the past 14 days. The third metric is a downward trajectory for positive tests as a percent of total tests within a 14-day period of time. And we appear to be seeing a downward trajectory for this particular metric. The fourth metric is to treat all patients without crisis model care or without crisis care model. So basically, we are not treating people based on limited resources. Everyone that needs to be hospitalized should be able to be hospitalized. And since April 1st, local hospitals have been reporting to the state all information related to hospitalization, ICU admissions, ventilator use, and as of yesterday, April 20th, the county has a capacity, or had a capacity as of yesterday, of non-federal beds at the number of about 6,509. The current number of hospital patients is at 4,452. So this is 68% of that non-federal bed capacity. Of the 4,452 hospitalized patients, 320, or 7%, are either COVID-19 confirmed cases or suspect cases. And last, the fifth metric is robust testing in place for at-risk populations, including healthcare workers, and that plan for a robust testing program must also include the use of antibody testing. So as I have shared with you previously, we have formed a laboratory task force, which is headed by our Public Health Laboratory Director, Brett Austin. So looking ahead in San Diego County, and with the information that I've just presented to you, we are continuously evaluating and reevaluating these metrics in order for us to plan for a phased approach that meets all 5 of the metrics I have just shared with you. The county is working with all of our various sector partners to appropriately plan for the phase 1 approach once we meet these metrics. And in this planning process, the county is preparing to ease our public health officers' order restrictions. This approach will begin with parks, trails and beaches, water sports, boating, golf courses, basketball, and tennis courts, as well as other open spaces with certain restrictions, including face covering and social distancing. So we will continue to reassess our metrics and share with you what the loosening up of restrictions will be. But as of today, we are asking everyone to stay the course until the 30th of April, and we will reevaluate and see where we are at that time. So from the governor's framework, the federal government developed testing criteria in March. And then the state developed new testing criteria as of Sunday, April 19th. The task force that I mentioned to you will be looking at these various testing criteria, and we will expand and develop additional testing criteria so that we reach our full capacity for the testing capacity that we have available here in San Diego. To date, we know that priority populations will include individuals with HIV and AIDS, homeless populations, long-term care facilities, as well as other racial groups and those individuals in rural areas, as well as other vulnerable populations that are identified. Now regarding the global, national, and state statistics based on data from Johns Hopkins dashboard that was pulled today, this morning at about 11:30 a.m. Globally, now we have over 2.5 million positive cases, which includes almost 175,000 deaths. Nationwide, there were almost 805,000 positive cases reported, including 43,200 deaths. Statewide, there have been 33,897 positive cases in California, which includes 1,229 deaths. Today, the County of San Diego is reporting 2,434 cases, which is 109 more cases than we reported yesterday, as well as 87 deaths, which is 15 more deaths than we reported yesterday. Of the 15 additional deaths, these include 6 females in their late 60s, mid to late 80s, and early 90s, as well as 9 males in their early 40s, mid 60s, and early to late 70s, as well as early to late 80s. All but one of the deaths that we are reporting today had underlying medical conditions. Now, of the 2,434 cases, the age range is unchanged. 3 months is the youngest to the oldest at 100 years of age. The population of individuals 20 to 49 years of age has remained constant, around 51%. And male and female distributions also are around 50% each. And then we have 6 individuals, or approximately 0.2%, that have no gender identified. Today, we are also reporting 592 hospitalizations, or 24% of the cases, total number of cases, as well as 199 ICU admissions, which is 8.2% of the total number of cases, but represent 34% of the total number of those hospitalized. And lastly, regarding the 87 deaths, this represents approximately 4% of the total number of cases. Of these deaths, 45% were female, 55% were male. And in terms of race and ethnicity for this group, of the 87 deaths, we have data for 84, which is 97%, which is improved over the past several days. Of this total, 47 or 56% are white, 25 or 30% are Hispanic or Latino, 9 or 11% are Asian, 1, which represents 1.2%, is Black or African American, 1 or 1.2% is of Pacific Islander descent, and 1 or 1.2% is of multiple races. None of those who died are American Indian, and 3 of the 87 deaths had unknown race and ethnicity available today. So our sincerest sympathies and condolences once again go out to the families of all those who have died, and especially of those recent cases that we have announced. As a reminder, all of this information can be obtained on our website at www.coronavirus-sd.com. And I just have two last statistics to share with you. Regarding outbreaks in congregate and community settings, today we are reporting a cumulative total of 33 confirmed active outbreaks and 1 inactive outbreak, which means there have been no cases reported in the past 14 days. Of the 33 active cases, 24 of these outbreaks are in congregate facilities, representing 419 cases and 43 deaths. And that is 1 new outbreak that is reported today in this group since yesterday. And then the community setting locations remains constant at 9 active outbreaks, which represents 60 cases and 2 deaths. Regarding testing, as of April 20th, county hospitals and commercial laboratories have conducted almost 35,000 tests for COVID-19. Or at least for the coronavirus COVID-2. And this includes the current total of 2,434 positive tests, which again is approximately 7%. And again, I would like to commend the public and all of our business partners, governments, and community-based organizations and faith-based organizations for staying the course, and those individuals who are not essential workers for staying at home to help decrease the spread of COVID-19. The sacrifice, and we know this is a sacrifice, but we thank you, and your collective efforts are indeed working, but we have to stay the course. So the current social distancing strategies are in place until the end of the month to ensure that we do indeed flatten this curve to reopen soon. So now I would like to welcome back to the podium Supervisor Greg Cox.
Thank you, Dr. Wooten. We're going to go directly to the calls now. And again, as we call up your call, make sure you identify yourself by your name and your outlet unless it's done in the introduction. So go ahead and let's take the first call.
NBC 7, please state your name and question.
Hi, this is Alexis Rivas with NBC 7. My question is, and I know Supervisor Fletcher mentioned you don't make decisions based on one day's worth of numbers, but given that this is the deadliest single day of numbers we're seeing of people dying from coronavirus, is there a metric for when you might reconsider the opening of some of these parks, or push that back or delay, or maybe go back to more of a strict health order? Is there numbers that would indicate it's too soon?
Dr. Wooten's going to answer that question.
Thank you for that question. The 5 metrics that I reviewed includes number of cases, or it could be the number of positive tests compared to the number of overall tests performed. It includes a downward projection over the past 14 days of not only influenza-like illnesses, but a downward projection of the COVID-19 syndromic conditions. And that's the one that we are not downward trending on. It's erratic at best. And some might say it's level, but it's not moving in the right direction, which is upwards. Now, today we will be releasing our COVID-19 watch. And if many of you are familiar with our influenza watch, it will have numerous graphics and metrics that we are following to determine if we are moving in the right direction. So I would encourage all of you to make sure that you get that document. But again, the 5 metrics that I reviewed today, those are the metrics that we're going to be using to determine if we're moving in the right direction.
Are you feeling at peace with, today reopening some of the parks, even given some of those numbers that came out today?
We are not reopening the parks. What the county is doing is we never closed our parks in the unincorporated area. We closed the parking lots so that we wanted individuals that live next to the various parks, they could walk to it, but we did not want individuals driving to it. And in talking with other jurisdictions, particularly the coastal jurisdictions, they have met as of yesterday. Supervisor Cox shared that information, and they are putting together a collective plan of what it would look like to reopen the beaches. But again, we have to look at the metrics that I've shared with you today, and we will determine next week what, if anything, that we can do in terms of dialing down. We've dialed up where we are now. So now we're looking at all of these various metrics to see where can we dial down. And we will be exploring that over the next 9 days. Thank you.
Thank you.
Okay, let's go to the next question.
CBS 8, please state your name and question.
Hi, my name is Brandon Lewis, and I have a question about the number of South Bay cases. The mayor of Chula Vista was saying that the cases are higher among her residents, but that data is not taking into account where the virus was contracted. So I'm wondering maybe if someone from county health can respond to concerns about tracing and the number of cases that we're seeing in the South Bay. And I do have a follow-up as well.
Okay. Let me see who's going to respond to that. I think they're gathering some information. Dr. Wooten's going to start.
I'll start. Certainly, if you look at all of the hospitalizations across the county, our numbers are higher in our South Bay area. Remember, however, that for individuals that are in Mexico, and even though we know that their cases are increasing there, there are a significant number of U.S. citizens that live in that region and legally are required to cross over if they need to access medical care. The Southern Bay or southern region of our county, The number of hospitalization aren't just increased for COVID-19, but we see that during the flu seasons as well. So the numbers are higher there. We have a system in place in our emergency medical medical services system. If hospitals do get impacted, those cases are distributed to other hospitals in their system as well as other systems across the San Diego region. And Dr. McDonald, did you have any comments? All right.
Okay, we'll go to the next question.
Union Tribune, please state your name and question.
Hi, this is Paul Sisson at the Union Tribune. My question was also about what's going on in South Bay and specifically with the two main hospitals in Chula Vista, which are closest to the border. Last Friday, as I recall, Dr. McDonald said that a task force was being formed to look at these issues. And the main question that we had on Friday and even a week before that was, where are these patients coming from? Seems to me you ought to be able to look at patient records and see where these folks live. Do they live in Mexico or do they live in the U.S.? And so can you tell me now that it's we've been through the weekend, and I know there was a meeting with the state and others on Saturday on this very topic. Has the county now had enough time to tell us what percentage of these folks in the Chula Vista hospitals have come across the border versus what percentage of them are actually living in the Chula Vista area?
Dr. McDonald's going to answer that.
Sure, thanks for giving me a chance to do some follow-up. We actually have had regular meetings of the group that is looking at what is happening along the border. This Unified Command Task Force that's looking at border dynamics that consists of the city representatives, county, the city of Chula Vista, the Emergency Medical Services, Office of Emergency Services from the county and from the state, the CDC, CBP, and others. And we are looking at this carefully, and it looks now that most of the patients who are being admitted to the Chula Vista hospitals are U.S. residents. A small percentage of them are individuals who spend time on both sides of the border, have addresses on both sides of the border. There are individuals who live in the United States and get some of their health care in Mexico, but then are hospitalized in the United States. There are some individuals who are live in northern Baja California, but actually get most of their medical care in the United States. But 95% of the individuals that we have been able to identify are actually residents of the United States. Not all are residents of San Diego. Some are residents of Los Angeles and Riverside, but they are, the vast majority are U.S. citizens. So does that answer your question?
Yeah, I have a follow-up.
Sure.
We observed over the last couple days that the border crossing lanes have all suddenly opened, and there's a couple-hour wait to get across the border entering into the U.S. at this point. I wonder what public health makes of that. Are any additional public health measures necessary to make sure that anybody coming in with COVID is detected and isolated appropriately?
Well, I think that you should address, specific questions about how border screening is done and the mechanics of that to the CDC, because they're the ones that have responsibility for health issues and screenings at the border. We are looking carefully at the number of ambulance transports that come from the border, and that's actually been relatively steady, actually over the last number of months, although the number of individuals crossing the border is in fact a lot lower now. So one could say that the rate is higher. The number of individuals who actually are COVID identified who are taking ambulances from the border is higher than it was 2 months ago, because we didn't really have COVID coming across the border, but it's still not a significant percentage of individuals who are coming for any medical reason. So we are actually following that metric daily. along with our EMS partners to see if that trend is stable or decreases or increases. But it turns out that many of the individuals who present for care in the United States are actually not coming by ambulance. They're actually coming across the border in private cars or walking across and then coming to emergency departments in the United States. Again, as I said, the vast majority of them are U.S. citizens who routinely get their care in the United States. So the dynamic is really not unusual. It's that the number of individuals who have COVID are just increasing as the number of cases are increasing in northern Baja California.
Thank you.
Okay, next question.
Voice of San Diego, please state your name and question.
Hi, this is Will Huntsberry with Voice of San Diego. I've got a question and a follow-up as well. So the last few days, on the whole, testing has increased a little bit. You know, it's around 1,000 a day, just above 1,000. But we have a capacity in the county, from my calculations of reaching out to hospitals and what you guys have said, of at least 4,000 tests a day. And you can tell me if it's more than that. But you guys have set up a task force several days ago. It hasn't made any concrete recommendations. It hasn't taken any action. Why can't we start using that testing capacity today?
Okay, Dr. Wooten's going to respond.
Well, Will, several days, the Rome wasn't built in a day. And we have convened our partners. You have to invite the partners. And in the interim, we are having internal meetings to develop or redevelop or enhance our action plan for the key objectives that we want to work on that I reported at the board meeting today. So our first meeting is actually next Monday with these sector, the various laboratory sector partners. And the primary goal the primary goal is to increase testing overall. But the primary objective number one is to focus on looking at our capacity, and you're absolutely right, and I've stated this multiple times. While we have X capacity to test, we have not achieved that capacity. And since our last board meeting, we've gone from 310 tests in our public health laboratory to now 1,000 plus. In the hospitals, they've gone from about 1,500 now over 3,000 plus. And that is just for the PCR testing. And then since the last board meeting, we have brought on rapid testing. So the focus of the task force is to bring all of the partners together and have each different entity identify what is their niche going to be. And we've had meetings with our CEOs and have asked them to have those discussions with their public health laboratory directors. So while you think nothing is going on, we've done a lot of work, and we will meet with all of our partners for the next phase next Monday.
So thank you for that answer, Dr. Wooten. As you guys have mentioned, as the governor has mentioned, the kind of number one factor people mention that we need to come out of lockdown is more testing. And you guys have said in broad strokes you want to use the capacity we have to test vulnerable populations. But is there no plan to use that additional capacity to work together with contact tracing so that we might not see who are the most recent patients that have tested positive, and then use that additional capacity to test everyone they've been into contact with? I mean, isn't that the way that we get a handle on how this is moving and when we can let people out?
Sure. Let me take the first part of your question and then answer the second part also. Testing is the key to moving forward to a more normal activities in the future. That's important. And you've identified a couple places where we can actually increase testing and where we are increasing testing. But everyone is focused on this lab capacity number, this number of machines and kits that are actually in the laboratory. It's important to remember that in order to successfully perform a test on an individual, you need to identify who the individual is, and we're doing work on that. You have to have a person who can take the test from the individual who's got proper personal protective equipment on. You have to have a viral transport media, you have to have a swab, you have to have a delivery mechanism to the lab that's going to actually perform the test, and then of course you have to have the test capacity itself. And we report regularly on that test capacity, and it's easy to focus on that, but not remember that there's an entire trail of activities before that that need to be in place in order to successfully test individuals. So one of the issues that we are struggling with, frankly, is that we would like people who have symptoms now who aren't coming into our medical system for good reasons, because we don't want people to be unnecessarily exposed. That would be a great group of people to test. These people might have close contacts with known cases, but right now we're telling them to stay at home and not touch our medical system because, number one, they don't need care, and number two, it's important not to transmit to others by having them come in for medical care for testing. The key is if we have enough personal protective equipment to protect those caregivers who are going to get those tests from those individuals, we will be in a much better position than we are now. And as you know, we are trying to make sure that all of our personal protective equipment is geared towards people who are acutely ill in the hospital. So again, it's a difficult trail of explanations, and you're focused just on the capacity, but remember there are a lot of steps that it takes to get to being able to utilize that capacity. And that is exactly what the task force is working on. Each of the medical systems are actually working on that, trying to say, hey, we have enough PPE and staff to be able to redivert to these other groups that need to be tested to take advantage of that capacity. So I'm hoping I'm explaining that well to understand why we're sort of apparently at a plateau of the number of tests that are occurring. We would love to be able to expand that, but we need to do it in a safe way by not having people coming into the medical system who are unnecessarily exposing individuals and not having healthcare workers unnecessarily expose themselves because of a lack of PPE. Does that help a little bit?
It does, yes. And the other part of the question that I just wanted to try to get a little more clarity on, obviously it makes sense to focus testing on vulnerable populations, so I'm not questioning that, but from what you've told me and other doctors have told me, it's important to increase testing around people who have come into contact with positive cases. And in the plan that I've seen presented today, I don't see that as a priority in the testing of testing the circles around the positive patient. Why is that not is it more important to prioritize vulnerable populations than that kind of testing that goes in sync with contact tracing?
Well, again, if you just look at CDC's well-delineated priorities of who's in the highest priority and who's in the least priority position, we're sort of working down that list. Individuals who are close contacts who have no symptoms are not a high priority, because if you test them, that tells you what's happening today, but it doesn't tell you what's going to happen in 24 hours. And so you actually, in those close contacts, it's best to have them self-quarantine and wait till symptoms develop to then test them. So again, it's all about timing and making sure that you're getting the biggest bang for your buck when you actually do the test. So we locally and in the state are following the CDC's prioritizations, and we're working down from the highest priority down to the lowest priority based on the availability both of the capacity in the lab and the ability to collect those specimens.
Right. It seems like we're, when you lay all this out, it seems like we're just behind what a lot of other countries were able to accomplish. And I understand much of that is out of the county's control, but when you look at like what South Korea did in other countries, it seems like they made sure they had the PPE to get the test done, and they tested much wider, and they used their full testing capacity, and they were able to come out sooner, and it seems like we're just not meeting that standard.
Well, it's all on what vantage point you have, Will. Dr. McDonald has done an excellent job talking about the upstream before the capacity, and I want to talk about the downstream and focus on that indicator number 6 that you've alluded to. And we, if you watch the board meeting today, we talked specifically about testing, about contact tracing and isolation. So we're looking at all of the elements of that 6th indicator that's in the governor's roadmap, and it does include contact tracing, and it also includes individuals that have been diagnosed and those that have been exposed. That is the bread and butter of case and contact tracing. We do that. We did that before COVID-19. We are doing it during COVID-19 pandemic, and we will do it afterwards. So we are doing that. What the task force's goal or vision or charge is, in addition to looking at how can we increase to our capacity, what are other niche areas? And as Dr. McDonald mentioned, the federal guidelines, we are following that. We are looking at what was just released on Sunday from the state, and we're adding our own prioritizations in there so that we can have a very comprehensive testing plan for San Diego. Thank you.
Thank you, guys.
Okay, we have one final call-in question.
10 News, please state your name and question.
Hi, this is Vanessa Van Hefty calling with 10 News. We're expecting a big heat wave this week that's going to stick around for a few days, and just wondering what the county's doing to help out our seniors. I'm assuming that the cooling centers that you have traditionally opened will not be an option.
Dr. Wooten.
Thank you for the question regarding cooling centers, and we do have an excessive or extreme heat plan that we will have to operationalize and work within the confines of COVID-19 pandemic. And you are right, while libraries are currently closed, we will have to look at if there are other options that we can explore for seniors and other vulnerable populations in San Diego. I don't have an answer for you today, but we plan to have a plan by the end of the week before the weekend.
Okay, Dr. Wooten, we're going to start with a question from Cheryl Clark regarding congregate care. It's a little bit long. Yesterday, I asked about family members who, upon hearing that a nursing home or congregate or community living facility is on the list of those where residents, patients have been diagnosed with COVID-19, want to bring their loved ones home. What advice would you give to family members who are worried that the facility may not be a safe place for their loved one? I understand these facilities do not have testing capability, so they may not be testing asymptomatic patients who, if they are infected, would bring that infection home and infect the household. What do you advise for those facilities or for those families that are worried and inadvertently could make the problem worse? For example, should nursing homes only discharge patients who have tested negative? How many times should they be tested negative before they can be discharged? A whole bunch. I can go back and revisit.
Well, that's a very, actually, thank you, Cheryl, for that question, as it gives us an opportunity to share what we are doing. I just talked about prioritized testing. Long-term care facilities are one of the priority settings that we have identified for San Diego County, in addition to what's been identified by the feds and the state. And we have a very robust long-term care facility sector group. And we are testing, offering testing to these facilities for staff and employees, asymptomatic and symptomatic, because we want to know what's going on. But as Dr. McDonald stated earlier, a one-time test doesn't give you or let you know what's going to be happen the next day or over the next 24 hours for staff or patients. The congregate care facility plan that we have is based on guidelines that are from the state. And we are working with, again, the various sectors to identify opportunities for testing. We are working with UCSD to help to have them work with the skilled nursing facilities in their catchment area, and we hope to replicate that in other parts of the county. Our staff, we have a dedicated group that when we get information about outbreaks in any of the congregate care facilities or community settings, we have individuals that go out and assess, conduct training, and usually the staffing at the long-term care facilities can conduct training. We again are working with UCSD to provide that similar service, and we hope to work with other hospitals to do the same. We also, and we also, in terms of long-term care facilities, we provide information to them every week, and we've given them the offer to have the county conduct testing, and several have already reached out to us. We sent a letter out to the facilities last week making that offer and request. The other thing that I wanted to share with you is that even before the state came out with the guidelines that if there is a case or rather an outbreak in a facility, that the staff and the family members of the residents should be notified. We've been doing that before those guidances. So everyone that is at risk will know if there is a outbreak in a facility where their loved ones are already located.
And I just really wanted to add one extra comment. And you know, the heart of the question is, what should a loved one do when they're concerned about the care that they have a relative in a skilled nursing facility? Really, the best answer is to talk to that skilled nursing facility, and indeed talk to the physician who's involved with the care of that individual. It's a doctor you know. And so I say that each one of these cases is individual, each location is specific, each of the needs of each of these individuals in a skilled nursing facility is unique to that person. And the best person to be able to help you with those kinds of decisions is the caregiver that's involved with the care of your loved one in the skilled nursing facility.
Thank you.
This next question is going to deal with contact tracing, and Dr. Wooten will respond to that.
This is from Jesse with Voice of San Diego. You mentioned this morning an action plan related to contact tracing and a surge in staff. Can you tell us how many people you're planning to hire, whether they'll be new hires or repurposed county workers, and the general timeline of this effort?
Well, thank you for that question. We've been conducting, as I stated earlier, contact tracing before COVID-19 and during COVID-19. We have currently 132 staff that are actively engaged in contact tracing. That includes 59 that are county staff in our EPI program, and then another 40 plus that are staff outside of our EPI program. We've trained last week 20 individuals that have been onboarded to actively participate in contact tracing. We are onboarding additional staff this week, and we will continue to onboard staffing support as is necessary to meet the needs and demands of our case investigations and our contact investigations.
I'm going to have you say I have a few. This question is from Saddam Aguayo from Univision. The top 3 zip codes with more COVID cases are also the zip codes with the most Hispanic population and closer to the border. Is there any special attention given to the communities in the south part of the county, and has the county identified any factors that contribute to these zip codes having more cases?
Well, I think we have identified that Scripps, Mercy, and Chula Vista are in the hospitals in southern region, and they have the highest number of COVID-19 positive cases. Is there, the southern part of the county is unique to the border, but as it was already stated, there are many people that live on both sides of the border, and Chula Vista is the second largest city in our county after the city of San Diego. So it would make sense that we're going to see some higher numbers there.
Okay, and this question is from Julian. They have 2 cases of residents being tested positive and are wondering what the process is that they should follow for contact tracing.
I'm not sure that I understand so who has who are the patients?
This is in Julian. You know, maybe we can get back to her with a more specific.
Yeah, I would need
answer.
additional information before I could answer that question.
Okay. We're going to go on to Hunter Sowards. When the county expands testing, and when will the county expand testing, and when that time comes, what tests will be given? And who is advising the team on testing requirements and will allow reopening when testing is expanded?
Allow reopening? Yeah. I don't understand that.
I think reopening of...
You mean as we reopen things back up?
Correct. I think that's
Yeah.
what he's...
So let me we'll talk about the first part. Who is directing this? That's the purpose of our laboratory task force. Our public health laboratory director is working with laboratory directors from all of our 7 hospitals that have stood up testing out of their facilities. And then also laboratory directors from Family Health Centers of San Diego. The testing process that I alluded to earlier is for PCR, polymerase chain reaction testing. That is the capacity I've already shared with you. I know we were focusing on capacity, but again, 1,000 plus tests in the county, 2,000 plus with our hospitals and clinics, and then commercial laboratories are also doing PCR testing. The newest and hottest thing now, in addition to that, is rapid testing. Now, the PCR testing takes anywhere from, takes about 8 hours to run in one 8-hour period of time, and over a 24-hour period, you can potentially double that. Rapid testing can take anywhere from 15 minutes up to 2 hours. And the various hospitals have different types of rapid testing capacities. So the county, we now have a rapid test platform, and there are 6 hospitals that have rapid testing platforms. So we are trying best to determine how to use those capabilities. In the county, we've identified 15 different settings that we are placing our rapid platform kits with, and we will explore what those results and findings are over time as we conduct testing in those settings.
Okay, let's see if we can move on to, this is related to the board meeting this morning. So this is from Matt Hoffman with KPBS. At today's board meeting, supervisors Jim Desmond and Kristen Gaspar pushed to have businesses reopen by May 1st. That motion failed, but do health officials believe that could have been feasible? And if so, why or why not?
From my understanding, that is what all of the different task forces that we've been talking about, and the metrics, examining those, and looking at the plans from the federal government and from the governor, as well as working with our sector partners. We are already in the planning process. Grocery stores, I've met with grocery stores and asked them to provide input. We have the Chamber Advisory Committee, and they are providing input. There are various sectors that are or will be providing input to us, and we will utilize all of that information to come up with a comprehensive plan. But again, everything hinges on the governor's stay-at-home order. If that is still in place, we can't do a lot. And then also, we are, what we will do to move the needle, if you will, or turn the dial down will also depend upon the guidelines from the federal government. And there are specific things that can and cannot take place once we meet the requirements based on what the governor sets in loosening up the stay-at-home order. If that occurs, then there are specific things that are in the guidelines from the federal government related to individuals, related to employers, and related to specific or specialty employers, as I have already talked about in terms of whether it's gyms or other facilities that allow outdoor exercise even.
And Matt's follow-up question is everyone at the county in agreement in terms of plans to slow the virus's spread, reopen businesses, and get back to a sense of normalcy?
Absolutely. We don't want to do this, but we have to protect the public's health. Nobody wants to close a business, wanted to do that, but the actions needed to take place, and also these actions are coming down from our governor as well. And it is not just in California, but it is across the United States. We are in the middle of a global pandemic. And these are desperate times, and sometimes desperate times deserve desperate measures. San Diego has done a really good job compared to other jurisdictions, and we hear this on calls, national state calls that we're on. So we've done a good job, and San Diego residents, businesses, and organizations have done a great job. So we just need to continue the effort, and we are looking at what things can we dial down so that people can get some semblance of normalcy back, but things are not going to be like they were before.
Thank you, Dr. Wooten.
This next question has to do with convention center testing, and we'll ask Rob Sills, the director of our medical operations center, to respond to that.
This question is from Lisa Halverstadt. Can you provide updates on COVID-19 testing at the San Diego Convention Center shelter and on the number of positive cases in the homeless community?
So on the convention center testing, yesterday there were 83 tests done, 36 of them are negative, 45 are pending results, and there were errors with 2 that will be redone. That brings the convention center exercise to a total of 199 tests that have been done. 149 of those have been negative, 45 are pending, and 5 that had errors and need to be redone. So still no positive tests at the convention center. As it relates to the total number of unsheltered, I will have to get that and get back to you out of the total cumulative. But at the convention center so far, no positives to date. But it is important to note we're only 1/5 of the way through the population there, so we still have a ways to go.
Thank you.
This next question deals with the field hospital, and we'll ask Rob Sills to respond to that question.
Okay. All right, let me find it. This is from Lindsay with the Union Tribune. Today, county officials said the field hospital at Palomar Medical Center would be set up tomorrow. Does that mean the hospital will be fully operational? If not, what does that mean?
Well, Lindsay, the federal medical station, right now it's sitting on pallets and crates up on the 9th floor, and it's staged and ready to be set up tomorrow morning. So there'll be a large number of people with clinical and county oversight that will arrive on site tomorrow morning, and then we'll set it up, set the beds up, the IV poles, IV pumps, everything will be set up and ready for use. We are not going to use this space until clinical indicators and the capacity in our county's hospitals dictate that we use this space. And this is a regional solution, and it never was intended to be the first solution. So as we work with the CEOs from the hospitals and we reach a certain level of capacity in those hospitals, then we will use this space. But no, we will not start using it tomorrow.
Thank you, Rob.
This next question deals with the spike in deaths that we've reported today, and Dr. Wooten will respond to that.
And this question is from Monica Dean with NBC7. Did all 15 of those patients die within the last 24 hours, or does that number represent deaths over several days that are just now being reported? Wondering if there are any reporting factors that would account for a large spike like this.
I think that we have said, and during even in influenza, deaths often lag behind the actual point at which a person becomes infected and goes to the hospital. And so today is Tuesday, typically on the weekend, and it wasn't just the spike in deaths, even though it was higher than the last couple of days. As you may notice, we've had a significant increased number in actual cases at 109. And over the weekend, sometimes laboratory tests are not run. So usually by Tuesday, you'll see that increased spike. So we hope that things will level out during the course of the week. But again, it is not unusual to see an increase in the first part of the week due to the fact that testing may not be done on Sundays or even sometimes on Saturdays, and deaths always lag behind the cases reported then after hospitalizations.
Thank you.
This next question deals with protests which are held over this past weekend, and Supervisor Fletcher is going to respond.
This question is from Danny Freeman from NBC7. Does Supervisor Fletcher believe these anti-stay-at-home protests are held in good faith or are malicious? And what would he say to protesters who will likely assemble again in the weeks to come?
Well, Danny, I think what we're going through is a very challenging time. Fortunately, it only tends to happen about once every 100 years, but it is unprecedented in our lifetime that we would have such an impact on our economy, on our way of life, our schools being closed, our outdoor recreation options being limited, and it's very disruptive and it's very challenging. And so I certainly understand the frustration that a lot of folks out there feel. But I think what's really important to remind each and every one of us is that the individual actions we take are not just designed to protect ourselves, it's designed to protect others. And so when we issue orders, it is not in any way to infringe on one individual person's freedom or liberty. It is designed to protect other people's life. It is designed to protect the integrity of our healthcare system. It's designed to protect our nurses and our doctors and our seniors, to protect one another. And so if there was ever a time where we truly needed to come together in a sense of community and be willing to sacrifice just a little bit for a little bit longer in order to protect one another, now is that time. And so I certainly understand folks' frustrations. I understand the challenges, the economic anxiety, the isolation, and everything we're going through. But the simple reality is what we are trying to do as a region is truly bend the curve, flatten the curve, buy ourselves time to build up our capacity, our testing capacity, our tracing capacity, the ability to put in place the right procedures and protocols so that we come out of this, we can come out of this strong. We can come out of this consistent. As we begin to rebuild our economy, we don't have to start and stop and move back and forth. And so I think our urging for the public out there is just that continued patience. Yes, it is a sacrifice. Yes, it is a challenge. Yes, it is difficult. But the only other option we have is not to adhere to these orders. And we can look around the world and around the country and see what their failure to act has brought to their society and has brought to their way of life, and that is a much greater price to pay than the momentary sacrifice we're all being to make. And so I would urge folks that you know, your free speech is your free speech, and you can speak it, and you can tweet it, and you can text it, and you can post it online. But we really are hoping and asking folks to continue to adhere to the public health orders that have been given. They're not out of a malicious intent. They're not out of a desire to infringe. They're out of a desire to protect. They're out of a desire to protect life, to preserve life. They're out of a desire to put ourselves in the region, in the position as a region that we can come out of this in the right way. And so we ask folks to hold with us just a little bit longer and resist the temptation of impatience and resist the temptation of impulsive action that is merely going to spread this disease and slow our ability as a region to recover. And we hope that people will continue to hang in there together with us.
This last question we have deals with the spike in positive cases that we've seen in the last day. And Dr. Wooten's going to respond to that.
This one is also from Taryn. Have you found at all that the jump in cases may be connected to people gathering for religious holidays earlier this month?
Actually, the incubation period is about 14 days. So Easter was last weekend, I believe it was. The earliest time that you will see the number of or an infection is 2 days or as late as 14 days. But as I stated earlier, these cases are not just from the past several days, and the deaths are not either. These are from last week, and because of delay or no testing occurring over the weekends, we typically see, if you go back for Monday, Tuesdays of each week, you'll see most likely an increase in the number of cases that are reported. So it would be a bit early to see any cases that have occurred as a result of exposure, any group gatherings that have occurred in the past week.
Well, that concludes our calls for today. Before we leave, I wanted to thank all San Diegans for working together in this unprecedented time. As I said earlier, it's really up to all of us to end this crisis by taking the recommended steps. If you need more information, please visit the COVID-19 website at coronavirus-sd.com. And don't forget, Live Well at homepage, hashtag Live Well at homepage, that is available at livewellsd.org. We'll be back tomorrow, and until then, please remember to stay in place, maintain space, and cover your face. We'll be back here tomorrow at 2:30. Thank you.